Okay, what a video to follow. Talk about radical openness. Okay, apartheid. Apartheid means separate. I grew up in South Africa during apartheid. That's where I became a Western medical doctor. These were the type of signs that I grew up with. I hated apartheid. But little did I know at the time that a form of apartheid, an ideology of separation and discrimination, actually existed in the medical world too. This is the South Africa I grew up in. Completely separate and unequal. One black and one white. We were forced by the government to live in completely separate areas, go to separate schools, use separate transportation, even sit on separate park benches. Everything was separate and unequal, even the hospitals. Here I am 33 years ago during my internship at Baragwanath Hospital, a so-called black hospital, actually the largest hospital in Africa. And this is where I had my first exposure to non-Western medicine. When we doctors couldn't help the patient's family would call in the local traditional healer, the Sangoma. And I noticed that sometimes these Sangomas helped patients that we couldn't. Yet the attitude of the doctors to the Sangomas was the same as the attitude of many white South Africans to black South Africans. Superior and condescending, sort of like patting a little child on the head in a patronizing way. And to be quite honest, at that time of my career, my attitude was no different. I thought I was doing real medicine, and the Sangomas were doing primitive medicine. This all changed the next year when I went to work in an area called KwaNdebele, which is a rural area that the apartheid government forced the Ndebele people to live. And this is me dressed up in Ndebele garb. But here I had more time to be exposed to Sangomas. And I understood, and spending more time there, I started understanding how important they were in the context of the culture. The people believed in the Sangomas and in their treatments, and they very often worked. And actually, it's no different in the United States today. We believe in our doctors and in their treatments. That's why when we get given antibiotics for viral infections, we get better, even though we know antibiotics don't work against viruses. So call it placebo effect, call it what you like. What you believe has an impact on any treatment you receive. So I worked there for 18 months, and it was a life-changing experience. But my wife and I didn't want to live under apartheid anymore, so soon after this, we came to live in the United States. And in 1984, I started an internal medicine residency at Lincoln Hospital in the South Bronx of New York. And some of you older folks know what type of area that was in 1984. It was full of crack cocaine and heroin addicts. It was a pretty rough area. And I soon became disillusioned with the medicine here. In South Africa, we couldn't afford to do expensive tests on everyone, so we had to take a really good history and do a good examination. We had to listen to patients. In the States, the medicine was much more procedural. It was much more about what the EKG, what the X-ray, and what the blood test showed. Taking a good history and the relationship with the patient was not that important. And that bothered me because that's what I loved about medicine. So I'd heard about this acupuncture detox clinic that was actually a part of the psychiatry department of the hospital, but was in a completely separate building. So I thought, I'm going to check this out because I don't want to be a doctor here. So I took this walk over to this clinic. I walk into this burnt-out building, and I see probably about the size of this room, and I see about 60 or 70 addicts sitting quietly with needles in their ears. And I went, holy shoo. These were the same type of patients, these heroin and crack addicts that were pulling out their IVs in the wards. They were really difficult to deal with. We had to sedate them often. And here they were sitting quietly with needles in their ears. I knew I had to explore acupuncture further. And I did. For the next 3 years of my residency, I was living 2 completely separate lives, one at the hospital and one at the acupuncture clinic. 2 completely separate and insular worlds with 2 completely different philosophies. At the hospital, I was being taught to see the body as a machine. If a part was broken, you'd either try to fix it or you'd take it out. It was heroic, dramatic. I saw the benefits of Western medicine. It's wonderful for acute medical emergencies, surgical emergencies, surgery, trauma, when you're acutely ill. It saves lives. It's miraculous for crisis care. But at the same time, I saw that once we had finished with this acute phase, we were only handing out drugs and suppressing the symptoms, sort of like Band-Aids. We had no tools to create health. Whereas at the Chinese medicine clinic, I was being taught to see the body very differently, as a garden. If the plant wasn't growing well or the leaves were turning brown, you'd look to see what the soil was like. Was your plant getting enough sun, enough water? Were the roots being impinged upon? You looked to see why the plant was going brown. You didn't just paint the plant green. I saw, too, that Chinese medicine wasn't particularly effective at crisis care, at emergencies, at trauma, but it seemed to be pretty good at creating health. So I was really excited by this revelation that I sort of came across, that the strengths of the one medicine are the weaknesses of the other, and vice versa. It was so obvious to me that the best medicine would be an integration of the two. I mean, it's just common sense. So I thought I would come out as a closet acupuncturist to my professors, who I knew respected me because they had chosen me to be chief medical resident. But when I came out with this revelation, which I thought was mind-blowing, that it was just common sense that we should be combining these 2 medicines, they were appalled and offended. And they told me I would be ostracized from the medical world and I should not pursue this. And I was deeply disappointed. I'd left behind a political system of apartheid only to encounter an ideology of separateness, discrimination, prejudice, and narrow-mindedness in the modern medical world. And this made me even more fascinated by exploring alternatives. So I started studying herbs and nutrition and meditation and yoga. And as I dug deeper and deeper, I saw there was this really important holistic perspective, which stood in stark contrast to my modern medical training, which saw organs or put organs into separate compartments with separate departments and separate specialists. But by now I knew everything was connected. And in the late 80s, I came across the brilliant work of Dr. Jeff Bland, who's probably the most important person to change medicine today. And I was struggling on how to integrate this Western and Eastern perspective, and Jeff had articulated this so clearly. And he's known probably best as being the father of what is now called functional medicine. And if you haven't heard of functional medicine combines the biochemistry and physiology of Western medicine with a holistic perspective of Chinese medicine and how to improve function. And then combines that with the latest research on nutrition and how our genes and environment and lifestyle all work together to create health. If you look at this slide, my functional medicine slide, which I'm obsessed about, in Western medicine, we like naming diseases in the leaves. In functional medicine, we are more obsessed with trying to work out the mechanisms of disease in the trunk and ultimately look for the root causes in the roots. And let's take inflammation as an example. Inflammation is probably one of the best known or universally accepted underlying disease mechanisms today. It's probably the cause of most problems we see. In Western medicine, we call it different names: asthma, diabetes, arthritis, Alzheimer's, even some cancers, arthritis. All these have inflammation as a precipitating factor. So what happens in Western medicine is we often end up playing whack-a-mole. So the inflammation pops up in one organ, we whack it with a drug. Only for it to pop up in another organ, whack it with another drug. And what ends up happening is we start giving people multiple drugs and we haven't dealt with the underlying disease mechanism. And as we all know, these drugs can create problems with their side effects. The beauty of functional medicine is we don't just paint the leaves green or suppress the symptoms with a drug. We actually look further down in the trunk, and ultimately, we look for the cause in the root. And the root cause of many diseases we see today is in the food we eat, in the chemicals and the sugar and the gluten, all of which can cause inflammation. And as another brilliant thinker of our time, Wendell Berry, says, people are fed by a food industry which pays no attention to health and treated by a health industry that pays no attention to food. So, as with apartheid, it was a narrow-minded ideology of separation. If we look at our medical system, it's crumbling too. We need to observe that our medical system is wonderful at crisis care, but it is doing a really poor job at managing most of the problems we see today. We have epidemics of heart disease and diabetes and autoimmune diseases and cancers, and I can go on and on and on, and we are not dealing with them adequately. We need to move beyond just treating symptoms and managing disease. We have to create a true healthcare system with a strong preventive component. And based on what I and my colleagues in functional medicine have seen, functional medicine addresses our current healthcare problems. We have the know-how. We can create a more effective medical system, a more efficient medical system, and a more compassionate medical system. As one of my heroes, Nelson Mandela, who took South Africa out of the dark ages of apartheid, says, "Impossible, it only seems impossible until it's done." Thank you. Thank you.